Hi, Dr. Bauman. I loved hearing your lecture. I got to sit in it for a couple minutes. But I know that you started your clinic back in 1997. Can you kind of take us back in what made you want to go into hair restoration?
Well, I never started out thinking I was going to be a hair transplant surgeon. In my teenage years, I was lucky enough to be mentored by a very prominent plastic surgeon in Manhattan. And I think it was before I even could drive a car, I was watching surgery. So these are the days before YouTube, before Snapchat, before Discovery Channel would let you in through the operating doors. And I had the chance to watch plastic surgery, cosmetic surgery procedures with my first mentor. And it was amazing. I was enthralled by what he did and how he did it. I loved the artistic use of the surgical skill. And seeing his patients thrilled, happy, loving it after they're, were completely healed and doing great. I mean, how it changed their lives. I knew that I was very interested in plastic and reconstructive work. I did keep an open mind through medical school and my internship and residency, always thinking that I was going towards something cosmetic in the realm of medicine and surgery. But it wasn't until I met a hair transplant patient did I really think about hair transplantation as something serious. Because I guess in the mid-1990s, I was like most people. I thought it was like pluggy and probably painful, and like, why would you ever do that or even perform it? It just didn't seem to make sense to me. I never really crossed my mind. I never saw a hair transplant through the training. And when I met this patient who was coming in for something else, and he told me that he had had a hair transplant, I started looking at his hairline, trying to figure out what's going on there. And because to me, it looked 100% natural. And so we started this really brief conversation about his hair transplant, what he went through, how he chose his surgeon. And from a layman's point of view, he told me what the procedure was like, and he explained single follicle implantation. And of course, he was totally thrilled that he fooled the surgeon, that he had had a hair transplant. And it really kind of shocked me into thinking, well, maybe I should probably look into this. This is something very interesting. But what I remember most about that conversation was how it changed his life. Because he, basically shared with me how the change in his self-confidence totally redirected his career path as well as his social interactions. And so his life completely changed after he had his hairline restored. Yeah. And so I knew that there was like a lot of power, emotional power, in the hair restoration.
Absolutely.
But I didn't know much about the technology. I was thinking, like I said before, that it was like pluggy and what's this single follicle and how is that done and so forth. And
or when you hear surgery, it's like, no, thank you.
Well, yeah, a lot of people don't, wake up and decide, because they have a cosmetic defect that they immediately want surgery.
Yeah.
And that brings us to the good news that today, you can stop the progression of hair loss if we get to it early, right? So, an ounce of prevention is worth a pound of cure in that regard. But anyway, that meeting with him kind of sent me on a diverted path to look into hair transplant surgery, both research-wise, look at the journal articles and textbooks, and the textbooks still look like all plugs to me, but I started to go into conferences and seeing the state-of-the-art work that was being done and the work that was being developed, and I eventually paired with a hair transplant surgeon out on Long Island who took me under his wing and showed me the basics of the procedure and the artistry, and that kind of, again, diverted my path so far that I decided not to go back to my original thought of plastic and reconstructive surgery, but I ended up doing hair transplants full time.
Wow. Okay. And I know that we were talking a little bit before this too, the age range that you see. And you were telling me you see kids in high school that will come that have been losing their hair.
Yes.
Why, what is going on? Why do you think that is?
Well, I mean, even for many, many years, we know 20% of men in their 20s, 30% of men in their 30s, 40% of men in their 40s and on are going to see some visible hair loss. About 50% of women, by the time they reach 50 years old, are going to have some hair thinning problem. But we definitely are seeing hair loss much earlier now. There's been a big trend that I've seen over the past 25 years in the field that we're treating younger and younger patients. There could be reasons for that, like, well, now we have more effective treatment options. Of course, early intervention, as I mentioned before, and as I talked about in the presentation, there are a lot of things that we can do to diagnose and get on top of the treatments before it really becomes noticeable that you're really thinning out. But I also think that we live in the modern age where nutrient supply is depleted, our stress level has increased, we're exposed to biotoxins and toxins and other things that might dysregulate the hair follicle function to a much greater degree today than we had maybe even just a few decades ago.
Right. Yeah. Okay. So taking back to preventative options. So I come from a generation where we're all about castor oil and rosemary oil, and you like will literally scroll social media and there's like these people rubbing these oils on their heads, and months later, oh, they have hair, like, and then, it makes you believe it and want to try it. And I feel like you read up on the research about those oils too, and it talks about increasing blood flow to follicles, and I'm just really interested on your opinion about things like that.
So I guess if you had asked me about, these herbal treatments, 10 or 15 years ago, I probably would have poo-pooed them completely.
Really?
But today we know that there are organic compounds that do have a biologic effect. Mm-hmm. And so even today, for example, someone who comes in with high stress, we might use like an ashwagandha supplementation to make their body more resilient to stress, to decrease the effects of stress and cortisol levels. And we know that there's research that shows that ashwagandha decreases those cortisol levels as you get into the evening time. And so that might be better functioning for the hair follicle for sure. Mm-hmm. Rosemary oil, there are some studies there, and it is a TikTok trend. But look, I wouldn't throw it out completely. I would just say in the horse races, there are horses that have won the race consistently, day in and day out, and then there's the long shot. Mm-hmm. And if you are losing hair every single day and you have hereditary hair loss, let's say, it's going to get worse without treatment. And so the most valuable thing that you have on your side is time. And we always say time is follicles. Yeah. Because if you delay treatment, if you're using, XYZ rosemary oil, and you continue to lose hair, you've lost a lot of time and a lot of follicles pursuing that, maybe not so effective treatment. If you have a really aggressive male pattern hair loss or female hair loss, we need to take a deeper dive. We need to look at your risk factors. We need to look at your hair loss measurements. We need to look at your hair density measurements, hair caliber measurements.
And that's things that you do in the clinic?
Absolutely.
Okay. So along with testing, now that we're on this page, so what kind of testing would you do to kind of find out the answers to those questions?
Yeah, so the most important test that we do is actually a questionnaire.
Okay,
and so it might seem a little bit funny that we say that, but I'm more traditionally trained in allopathic medicine, where we actually took a history of the patient before we ordered a huge battery of tests.
I love that. That's great.
We do spend an hour with the patient in the practice typically to dive into these risk factors. What is their hereditary situation? Do they have male or female pattern hair loss or other maybe autoimmune conditions, things like that might appear in their genetic, known genetic history, what's happening in their family. And we take a look at their lifestyle factors, their nutrient and fuel intake. We look at other things like sleep-wake cycles, because if you're dysregulated on circadian rhythm, you're gonna have skin effects for sure. Like if you're jet lagged, you're gonna sunburn worse. We know that. Your psoriasis is gonna pop up. You could, lose more hair if you're working night shift than if you're working day shift. So we take a lot of time looking at all of those things and talking about that with patients more now than ever before. Okay. So before we order a single blood test, we're going to look at their lifestyle factors first and try to get a deep history and in-depth history of what's going on with their hair loss situation. Male pattern hair loss, do we need to take a young 20-something and put them through a battery of blood tests? No, of course not. We're gonna jump to the chase here and get them started on some medical therapies. Okay. Or at least talk about it.
Okay. And so what would that entail? What does that mean? So you see a 28-year-old male come in, he needs hair. Well, what therapy do you pick?
Well, again, first looking at his risk factors. So is he an athlete? Is he competing? Is he taking creatine, which might be increasing DHT production? We know that dihydrotestosterone is the main trigger for male pattern hair loss. So we have to at least have the discussion of what are the things he's doing that are increasing that DHT production. Is it something he's going to want to continue and take the risk of doing that? For example, like the creatine. Yeah. Or maybe he wants to take a nutraceutical or pharmaceutical intervention that reduces the production of DHT in the body. Okay. Because we know that's the strongest tool in the toolbox. Right. Right? Decreasing that negative impact of dihydrotestosterone. Right. So, is it the old Propecia or finasteride? Well, maybe or maybe not. We might not apply finasteride, which blocks the DHT production, inhibits the production in the body for men. A lot of men don't want to take the risk of sexual side effects with that medication, even though it's rare and reversible and very mild. They may say, no, I don't want to deal with that. So we might do topical finasteride, for example, which essentially reduces the risk next to nothing in terms of systemic absorption of finasteride. But there's so many other therapies that we have today. Yeah. Red light therapy, for example, and we're here at Biohacking, so every other booth has got some red light. Yep. But I caution patients, your LED red light panel that you're using for total body wellness is probably not going to grow much hair.
Right.
So we need to use a device like the turbo laser cap, something that you're going to use 5 minutes a day at home that's going to be able to impart enough energy over enough time, and the dosing strategy that we've determined is most effective at regrowing hair.
Okay.
And so the evaluation process is going to elucidate for us, are there follicles that are weak and thinning?
Yeah.
Are there areas that are severely depleted and gone?
Okay.
And that's important. If they're weak and thin, then we can implement these other non-invasive treatments.
Right. Okay, so weak and thinning hair. Okay, so walk me through the cycle of hair. I know there's a cycle of growth, of hair growth, and I'm just so curious why some people lose their hair and others don't. Is this a genetic component? How does that filter through?
Yeah, great question. The primary trigger for hair loss is a genetic inheritance, right? So you're going to inherit that sensitivity to DHT or androgens.
Okay.
And this can happen both in men and women. We see it in women who have high androgens, let's say PCOS, polycystic ovarian syndrome.
I see that often.
Yeah, and that hair loss is a very strong component, as well as acne and weight gain and so forth. In men, for sure, if they're highly androgen sensitive, they're going to start to lose hair right after puberty.
Interesting.
Yeah. So that's genetic.
Okay.
So there's lifestyle and genetic factors. There's also extrinsic factors.
Yes.
So if you're a woman and you're doing a lot of chemical processing of your hair, exposures to heat and exposure to chemicals can certainly degrade the hair fiber itself, right, which doesn't self-repair on its own. The follicle builds the hair fiber, right, from the inside out, like your fingernail.
Right.
Builds the keratin fiber.
Okay.
But if you disrupt the hair follicle, like with inflammation at the level of the scalp, then you can trigger some hair loss as well. So we focus a lot on scalp health.
That's great. Yes, scalp health. So I've been teaching my husband to scrub his scalp with a scrub, and we've tried rosemary oil, we've done a lot of castor oil. For those that don't know, my husband is bald and I love him for it, but we're always trying these other modalities before embarking on a complete hair transformation journey, like I saw in the slides. Very impressive before and afters. But say someone walks in and they're like, I don't want to do something so invasive yet. Is that when we would run the labs, you would recommend medical treatment and see if that works first? Or what's like the plan of action? Is it kind of patient catered, or is it your recommendation first?
Yes. So, there's a general stepwise algorithm that we follow for sure. But as I said, if it's very obvious that he's got extensive male pattern hair loss and he's a pretty healthy guy, certainly I would never dissuade someone from doing their annual blood work and looking at biomarkers and things like that. But we've got to get on the hair loss situation first and foremost.
Right.
So if he has some hair left that's weak and wispy and thin, we definitely want to initiate therapy. Is it going to be pharmaceutical or nutraceutical? Are we going to do phototherapy with laser light, like the turbo laser cap? Are we going to do some regenerative treatment? For example, like PRP, platelet-rich plasma, something like that, to help protect and fortify the function of the follicles that are at risk. We've got to do that up front, first and foremost. So sometimes, yes, it's a topical medication or oral medication. It could be minoxidil, finasteride, or it could be a nutritional or a nutraceutical.
Yeah.
But if the follicles are dead and gone and he's got extensive depletion of density, he's going to need a hair transplant to regain coverage.
And that's something that you'll be able to tell in the consultation is like, hey, your follicles are dead?
Correct. Yeah, because once the follicle miniaturizes, you asked about the hair cycling, right? So
yes.
As the hair follicles are affected by male pattern baldness, just as an example, they miniaturize. So the follicle produces a shorter, thinner, weaker, wispier hair over time.
Okay.
Spends more time resting than growing. And those ratios of the growing phase to the resting phase change. And so eventually, instead of getting this long, thick, dark ponytail hair, you get a shorter, thinner, weaker, wispier blonde hair. And it really goes down to 2 millimeters eventually, which is the same kind of hair that you have on your cheek that you can't see, right? There's no coverage. If that happens, those follicles are basically beyond repair. So we don't have a way right now to rejuvenate what we call a vellus hair. So a hair that's 2 millimeters, less than 30 microns in diameter, that's beyond repair.
Okay.
So people will say, oh, is it dead and gone? Well, it's there, but it's not able to be rejuvenated.
Without a hair transplant.
Correct. You need a hair transplant to replace a follicle.
Okay.
Yeah. But there's a lot of in between, meaning that there's some time while the follicle went from really good, thick, dark, strong, let's say, to wispy and thinner, to take action and rejuvenate that follicle.
Interesting.
And that's one of the things that we do very, very keenly, very aggressively in the practice.
Okay.
Because the reason why we do that is because transplants, if we restore the hairline, for example, transplants are permanent, but your other hair is not. So you still have to protect your other hair.
Wow. Okay. So going back to the labs. So you run labs. Someone comes in, you run the labs. I'm sure. Do you run thyroid panel?
Yeah, so that's going to be more common typically for our female patients, maybe
Okay.
perimenopause, menopause patients, who may have a constellation of other symptoms that might bring to light that maybe we should do some lab work to see what their hormone levels are. Is the thyroid dysregulated? What's going on? Are they on thyroid medication? That could be making things worse instead of better. So the good news is that if you need all of that, I have a functional medicine department inside the practice. So certainly, we make the appointment for that if that comes up, and we can dig deeper. But also, we're not waiting around to look at your lab work to get started with stimulating the hair.
Okay.
I mean, yeah, we want to get rid of the risk factors. It'd be nice to regulate your hormones, but
Right.
I mean, in my
that
department,
would be more root cause.
Yes.
Well, I guess more metabolic chaos, like what's going on in your life as far as your diet and your lifestyle, and are you resting, and how's your stress level?
Yes.
And that's potentially could be the reason why your hair is falling out, your hair is thinning, you're not growing it properly. So I feel like there can be a lot of power in lab work.
Absolutely. There could be some key things that we're going to look to figure out what's going on.
Yeah.
But remember, let's just say the woman comes in and she's got excellent hair density and quality around the back of the scalp, but she's thinning in the temples or in the frontal zone. That's a pattern. That's female pattern hair loss.
And that's genetic?
Yeah.
So that's from...
Correct.
Interesting.
Correct.
So there was nothing that she could have done about that.
Well, I mean, like we said, all of those other things you mentioned, lifestyle factors, nutrient, hormone balancing, all of those things can affect the hair follicle, right? If they're out of whack, so to speak.
Yeah.
But she was obviously prone to some female pattern hair loss because of the way the hair is falling.
Yeah.
Now, if the hair is completely diffuse in its pattern of loss, then it's a separate story. We need to figure out, exactly what's going on.
Okay.
We need to maybe and does she have scalp symptoms? Is her scalp exceptionally dry or oily? Is it itchy, irritated? Is it flaky? Is there folliculitis, which looks like acne of the scalp?
Yeah.
So we're going to look at that, look at the microbiome of the scalp, see what's going on there, and maybe we have to change her hair hygiene situation. Maybe she's seeing some shedding. This is very common in the practice. She's seeing a lot of shedding, so she's stopped, shampooing so often. She just shampoos once a week, and doesn't use as much conditioner. And so there's all these things that are contributing to the situation, and maybe not in a good way.
Mm-hmm. Is there anyone who would not be a candidate for hair transplant?
Well, yes. I mean, many patients come in and they're in the earliest stages of hair loss. They notice that there's been excessive shedding, maybe due to a stressor, or COVID, or vaccination, or something.
Yeah.
They may not need a hair transplant right off the bat.
Okay.
But they need something to fortify and help the function of their hair follicles, for sure.
Okay.
And these younger patients, patients that come in, let's say they know their dad has had a hair transplant, and the dad brings the son in. I think he's receding a little bit. Well, it's normal to recede after puberty a little bit. Let's do some measurements. Let's watch and wait. Let's talk to him about nutrients and fuel. Is he on a vitamin that could be helpful? Is he missing protein? Is he on a vegan or vegetarian diet, which can often really disrupt the hair follicles?
Okay. Have you ever seen a completely bald man come back from that without a transplant?
Without a hair transplant? Only in cases of alopecia areata. So alopecia totalis, alopecia universalis, these are autoimmune conditions where the body is fighting against the hair follicle and disrupts it completely. And so you can lose all the hair on your head, you can lose your eyebrows and all of your body hair due to that autoimmune condition. The interesting thing is that over the past couple of years, we now have a plethora of FDA-approved medications that will basically knock out that autoimmune. So tofacitinib, ruxolitinib, these are JAK inhibitors, Janus kinase inhibitors, which basically shut down your immune system and enable you to regrow hair in those autoimmune conditions. So that's a totally bald patient who now shut down their immune, essentially, system, and now they're regrowing a full head of hair.
Wow. Okay.
So those are pretty exciting to see.
Yeah,
I honestly don't see a lot of that in the practice. For whatever reason, it's just I just don't see too many of those. But some of those medications come with high risks, as you can imagine. Anybody can look up JAK inhibitors and see what the risks are. But the bottom line is that those biologics come with some risk factors.
What about the minoxidil?
Minoxidil. So you're kind of moving back into FDA-approved treatments for male and female pattern hair loss. Minoxidil is approved for both men and women topically on the scalp. It's been around since the 1970s, typically in a form of Rogaine, which is notoriously greasy and gooey. It doesn't really penetrate all that well. So today we have compounded topicals, which penetrate better. They have other ingredients besides minoxidil to help it work better, maybe an anti-inflammatory, like fluocinolone, tretinoin, which helps activate the conversion of minoxidil to minoxidil sulfate in the skin for better response.
And this is a topical still?
Yeah, so that's a topical. And then oftentimes we'll use minoxidil now orally in a microdose.
Okay.
So that's really been a game changer for many patients who either couldn't tolerate a topical minoxidil or just couldn't be compliant with it.
And what exactly does minoxidil do?
So minoxidil is a very potent hair growth stimulator. It's a potassium channel opener, so that's the mechanism of action. But basically what it does is it turns the follicle, if it's in a resting phase, it turns it into a growing follicle.
Okay.
So that's good news.
Yes.
And if the follicle is already growing and it is about to turn off, let's say prematurely, it will keep it in that growing phase.
Okay.
So minoxidil is an anagen, which is the growing phase, prolonging agent and stimulating agent.
Okay. So this is something that would work for most people unless the hair is dead.
Correct. Minoxidil is a first-line treatment for many patients.
Okay.
Minoxidil oral, like in the microdose that we just talked about, is very safe. In the microdosing strategy, we can avoid systemic side effects. Obviously, minoxidil has no sexual side effects whatsoever, which is nice for both the men and women.
What side effects does it have?
So if you overdose on minoxidil, remember minoxidil was a blood pressure medication back in the 1970s.
Right.
And it caused hair growth all over. And they determined that one man's side effect is another man's pot of gold, I guess, so they turned it into a baldness drug, and that's how we got Rogaine.
Okay.
So oral minoxidil at very low doses should not tank your blood pressure.
Okay.
But if you go higher on the dosing strategy, then sometimes you can get low blood pressure effects. And so that would manifest as headaches or dizziness typically.
Okay.
Sometimes you can get water retention. It's also very, very rare.
Yes.
But it can happen. So what would we do? We just stop the medication for a day or two. Water comes out of the system. Maybe we would add a diuretic or not, potentially, or restart the dose at a lower dose.
Okay.
But minoxidil oral has been a game changer.
Really?
Yeah, but the compounded version is really what you need. You need to use the compounded version.
And how long has that been around?
So, oral minoxidil was originally available back in the 1970s, and we've been using it as an oral dose for hair growth for 10 years. But last year, the New York Times did a front page cover story on minoxidil oral treatments for hair regrowth. And so that kind of started a next wave of, let's just say, interest in people who have hair loss. Yeah.
Okay.
Very powerful in combination with some of our other treatments like laser light or other pharmaceuticals like finasteride for both men and postmenopausal women.
And this isn't only for scalp hair. Like this is literally for body hair.
Well, minoxidil could be used for guys who want to grow more chest hair or want to stimulate their beard.
But you can't target where it goes.
Well, topically you can.
Okay.
Yeah. If
you take it orally, then what is happening?
Orally, it's going throughout the entire system, and you can get more body hair. Yeah. So for women, that can be a concern. You don't want to.
Slight concern.
You're not going to wake up with a goatee. I'm telling you. But sometimes a little bit of extra peach fuzz here or there can be concerning.
Yes.
And that's also one of the reasons why we have laser hair removal now at Bauman Medical, so that you can grow your hair and remove it
and take it off. Yep.
Yeah,
okay.
Because hair is one of those pesky organs that too much in is can be a problem in some areas, but not in others. So.
Yes. Okay. Very interesting. I kind of want to switch gears a little bit. We have a couple more minutes. But I'm really fascinated, as I told you before this, I'm a clinician myself, so I see a lot of, autoimmune and chronic disease, a lot of lifestyle. I work a lot with patients on lifestyle, diet, exercise, stress reduction, supplementation. So just really trying to get them back, out of metabolic chaos, per se. And a lot of young 20s with thyroid dysfunction, and they are seeing severe hair loss from that.
Sure.
So knowing that that's like a root issue, and you mentioned that is something that you address in your clinic on the functional side.
Absolutely.
Okay. So you're, really trying to help men and women get an optimal thyroid function.
Yeah.
And then do you ever see them start to regrow hair just from that?
Well, it's certainly possible, absolutely. But, most people who are coming in with a hair loss situation, they're not just going to want to wait around to, like, fix your thyroid function type of thing. It's like a woman who's coming in, for example, with, perimenopause or menopause, yeah, they want their numbers to look right, but they want their hair growing back, you know?
You're cutting to the chase.
Yeah, so we do accelerate. I mean, hair, it's always a hair emergency, right?
Yeah.
It's a 911 hair emergency, whether it's just thinning or breaking, or you have significant hair loss. So we've got to get on it. So at the same time that we're doing our deep dive into metabolic health, we might be instituting other treatments like home laser light therapy or PRP, platelet-rich plasma, or doing treatments in the office like the TED, transepidermal delivery, which we have here at the booth. And honestly, if we found that they are severely depleted, we might be talking like you might need transplants at some point. So it's still a piece of the puzzle. Yes, of course, we're going to try to correct those underlying causes, but in general, they're going to need that. Reducing those risk factors is going to be helpful, but we probably will need something more in addition. So we're very clear that, look, it's whatever the patient feels comfortable in terms of their speed. Even in terms of multi-therapy. I mean, you saw in the presentation, multi-therapy is magic, right?
Yes.
Minoxidil plus laser or PRP plus this. Those therapies are synergistic. They're not redundant.
Yes.
So very oftentimes we'll put them together. But a patient might say, well, I just want to try this first. I want to, dip my toe in the water. Well, of course, we've got good evidence that that one treatment can work. We're going to measure it in 90 days and 6 months, see how it goes. If you got a good response, but you want a better one, then let's add something to it.
Right.
So it's at the person's individual pace.
Okay.
And their level of concern.
Yeah.
Like some guys who are 50 plus, they might not necessarily care about a bald spot in the crown, but they're concerned about their hairline because that's what frames the face. Or a woman who is in menopause, who is on hormone optimization therapy, if she's using testosterone, whether it's a cream or injection, whatever, or a pellet, she could have receding hairline and other issues due to the testosterone replacement. Not just the good effects, but also some of these side effects as well, especially if there's too much.
Yeah.
And if she's androgen sensitive. So a lot of patients today are coming in with those conditions. And unfortunately, some of them are so bad that they need repair. They need transplants to fix it.
And that's why they come to you. And what kind of timeline do you give them? Is it like a 6-month thing? Is it a year thing? I know everyone's probably different, very individualized per treatment, but as far as a general guideline?
So, I'm a biohacker at heart. So we track everything, right? I want to know my sleep score from last night. I want to know how many steps. The data is like overwhelming. And, there's so much data, heart rate variability, you name it, right? So for our patients, though, I recommend they come in 90-day intervals.
Okay.
So are they growing a full head of hair in 90 days? Of course not. I mean, even a hair transplant takes a year to grow in.
Yes.
But an intervention like whatever we discussed, in 90 days, we're going to get a clue.
Okay.
Instead of you having to wait and try to judge it on your own, either with a photo or or some other ask a friend or take a look at your hairstylist. What do you think? Kind of like polling the audience. The measurements tell you exactly what's going on in each area of the scalp, and so hair grows about 1/3 of a millimeter a day. So it's not like super fast. It takes time. It takes a month to grow 1/4 of an inch of hair. And so it takes 90 days for us to start to see those changes in measurements. And then if we're able to keep those changes at that same level or even improve by adding maybe another modality, then at 6 months, you're going to start to feel and see the changes usually in the mirror, when you're combing, when you're styling.
Yeah.
But for every intervention, it really truly takes almost a year to see its full benefit.
Right. Okay. Last question, because I really want to understand like the full process. So someone comes in, they do hair restoration or repair. Transplants. Yes. Sorry. Then, that whole ordeal takes place. What's the aftercare look like? Like, what's the home care? I feel like I'm like thinking, in the photos, it looked pretty rough.
What's the downtime, right? That's one of the things on everybody's mind. First of all, they always want to know, does it hurt? Of course not. We're using great local anesthetic techniques to keep you super comfortable. We use ring block, which means that the entire scalp is completely numb during the procedure.
Okay.
So literally patients are sitting in the chair, we're working, they're watching TV,
so they're not feeling
a movie.
anything.
They're not feeling anything except vibration or tapping.
Okay.
And by the end of the day, usually the team and them are doing some karaoke, so it's a pretty comfortable process.
Okay.
Now, afterwards, once the medication is wearing off, usually patients will use maybe a Tylenol or Motrin or something like that at night.
Yeah.
Okay. But then after that, all you're dealing with is a cosmetic recovery. So you've got crusting and scabbing that's visible to the naked eye. So that crusting and scabbing takes some time to flake off.
Okay.
And everybody's a little bit different. Today, I mean, we're here at Biohacking, so we know red light therapy, probiotics, and special care of that area is really going to accelerate the process.
Okay.
And so, we low-level laser light them before and after every procedure. We use a nano-V, which is a reactive oxygen species signaling during their procedure.
Okay.
If you're Dave Asprey, you're going to do rectal ozone.
Oh, gosh.
But everybody has their own biohacks that they like to do.
Right.
But the point is that this minimally invasive hair transplant process leaves you with no linear scar. Okay. There's no stitches or staples, so there's no tension or tightness that you've got to take Percocet for.
Right.
Anyway, a little bit of puffiness sometimes is visible in the forehead the day after the procedure, and it takes maybe 72 hours for that to completely resolve if you do see it. And the crusts are flaking at about 6 days. So then the skin is basically back to normal. The skin tone returns to normal soon after that. So activity-wise, 3 or 4 days, you could be back in the gym, light cardio, light resistance training,
3 to 4
sweating, no
days?
problem.
Oh my gosh, I get like microneedling and I'm out for like
Oh, no. Well,
for like a week.
well, you might be sensitive, and some patients are, but you could theoretically be back to physical activity. Now, of course, no MMA fighting. You're not going to do yoga poses standing on your head. You're not going to put the grafted area at risk, which would be friction or trauma, right?
Yeah.
So every single day after the procedure, if you can, you would come into the office once or twice a day, and we do a treatment to the scalp. So that would include the laser light, a wash, the misting, all of that stuff. And then by the time we get to 6 days or so, we're exfoliating those crusts in the scabs. And so once the crusts are gone, you're free and clear.
Okay.
You can go back to wearing a helmet, go biking, whatever. I don't care if you want to jump out of an airplane.
Is it really noticeable after? Like after the crusts fall off?
No, you don't see anything.
You don't see anything?
No, you're back to normal in 6 days. 6 to 8 days, the skin tone is basically back to normal. If you're super light complected, you might see a little pinkness or redness. That might take another couple of days or a week or so to resolve. The hair growth from the transplant doesn't kick in for 4 to 5 months.
Okay.
So you're not going to see anything after a week.
Okay.
Most of our high-powered professional CEOs, entertainers, they'll usually take about 2 weeks off. If you're the anchor man, you're going to take 2 weeks off of HD camera,
TV,
right?
Yeah. Okay. Wow. That sounds like a lot simpler than I thought.
Yeah. Well, this is not the day and age of the old strip harvest hair transplant process, which was so much more invasive.
Yes.
This is much easier, much more comfortable on the patient.
Yes. Which I was born in the 90s, but I do actually remember the plugging. Like I feel like I had that image in my mind. So
well, they're still visible today.
Quick.
Yeah. Well, the hair still grows. So there are plenty of people who had plugs back in the 80s and 90s that are still growing plugs.
Yeah.
P.S. We can recycle those, right?
Right.
We can harvest those follicles out, put them back in. We can cover old-fashioned linear scars. There's a lot of things that we can do to help kind of touch up and top off and refurbish, if you will, old-style hair transplants.
Absolutely. What great work, honestly, because like you said at the very beginning, like the confidence level that you probably see in people when they walk in and when they walk out and then after a year's time is probably just such rewarding work. And that's amazing.
Every single day, I get the chance to see patients who we've operated on 6 or 12 months previously, and they're growing like gangbusters. And to see their eyes light up when they see the before and the afters, or just telling me about how their friends notice that they're looking different, or they're working out more, they may not even notice that it's the hair because it looks so natural. It takes me back to that first day, kind of full circle back, almost 30 years ago when I met that hair transplant patient, that I was fooled. And he was super psyched. Not just that he fooled me, but that he had a great result from his procedure and that his life changed after that. So.
Yes. And it looks completely normal. It looks like exactly nothing happened.
100%. So using artistry and technology, we can create something that looks like Mother Nature has created it.
Wow.
And so unfortunately, though, that's the downside. There are practices out there that do hair transplants once a month. And there are clinics, that you might find around the world that are, low budget clinics where they're just giving you a straight across hairline and the hairs are growing in crazy angles and it doesn't look normal. It doesn't look natural. And unfortunately, that's really set the industry back a lot.
Well, because you even said in your lecture too, like you had a video of you like putting them in a certain way.
Correct.
On the scalp. So it is an artistry.
Yeah. Every single hair follicle or graft is placed with a very intentional angle, orientation, and position to make it look normal and natural.
Wow.
Think about how intricate, like if you looked at your eyebrow. Like we do eyebrow transplants and eyelash transplants, but if you look at an eyebrow, there are hairs growing upwards and downwards, and the patterns are different from the head to the middle to the tail.
Yeah.
I mean, each and every follicle that we place in an eyebrow has to be carefully aligned and oriented to make it look normal. And the same kind of care goes into a hairline, as well as even a swirl in a crown.
Yeah. Wow, that's beautiful. Well, thank you so much for chatting with me today. I truly enjoyed it. This is really rewarding work. I've been enlightened. I've been learned a lot, and we may be coming to see you.
All right.
But thank you so much.
It would be my pleasure to see you in Boca Raton, Florida.
Yes.
And for anybody that you may have in your neck of the woods, you can always direct them right to the office or to BaumanMedical.com. That's the best place where they can find thousands and thousands of pages of information that I've written personally.
Wow.
Hundreds of hours of videos of all types of therapies and treatments, some we didn't get a chance to chat about today.
Right.
And they can always start their hair restoration journey there, either by asking a question and I'll respond, or start their consultation and their hair restoration journey that way. From virtual, from all across the world, we have patients that start their treatments that way.
That's incredible. I know you do PRP. I've heard of that. I know a lot of my friends have heard of that. So yeah, lots of treatments that we didn't get to touch on, but I will gear them to the website. So thank you so much. This has been great.
Thank you for having me.
Yeah.